I know ever since I've been involved with the foundation, the biggest question I get asked is, are there resources? Is there a list of resources that are available to help us navigate this space? So it's really fantastic that she put that all together so that you have that as a takeaway. So thank you very much, Sandy. Next up, we're going to talk about cognition and mood in ataxia. And to do that, we have joining us Lucille Carriere, who is the staff health psychologist and director of behavioral health program at the Cleveland Clinic here in Nevada. And then we also have Sharu Pudemchi, who is the director of the neuropsychology service at the Cleveland Clinic here in Nevada. So please help me in joining Sharu and Lucille.
Thank you. Okay. All right. Sorry, where's the clicker? Hi, everyone. My name is Sharu Pudemchi, and I'm a neuropsychologist here in Vegas. Sharu Pudemchi is a mouthful, so Dr. P works just as well. And I'm going to endeavor today to give you an overview of cognition in ataxia, and I'm honored to co-present with Dr. Carriere here, who will cover the mood aspect. So just a few housekeeping pieces before we begin. And then neither Dr. Carriere nor myself have any disclosures. So with mood and cognition in ataxia, the cerebellum plays a very important role, and I'm going to come back to that and talk about that a little more. Mood and cognition are one of those invisible pieces. They're hard to detect in some senses, and so they are often under-recognized and underdiagnosed. It also relies a lot on our ability to sense these changes, or our care partners' ability to sense these changes. And so it's a little bit sometimes harder to detect. Both cognition and mood, if impaired, can have pretty significant impacts on one's daily life, both in terms of completion of daily activities, doing things around the house, working, et cetera, as well as social and occupational functioning. So when we say social and occupational functioning, the obvious impairments such as social withdrawal and things like that might impact it, but it's also that apathy, losing that get up and go, losing that initiative to do things might also impact one's ability to interact socially. And then, of course, it has impacts on how the disease is managed and how one is able to cope with certain aspects of it. Whoops. All right, so I'm not sure what those little black boxes are, but I want to talk a little bit about this big, beautiful brain that we have, right? And most often when people are talking about the brain, we hear these terms, the frontal lobe in purple, the blue parietal lobe, the yellow occipital lobe, and then you have your temporal lobes. So this is a side view, so you have two temporal lobes, one on each side. And a lot of if you go down Google, the rabbit hole that is Google, and you look at the reasons for memory changes, the reasons for changes in language, you're going to find a lot of information about these four lobes and these four sort of specific neuroanatomical regions. But what I want to focus on is the cerebellum. And this is a critical structure, as most of you know, in the development of ataxia. More and more research is suggesting that the cerebellum, or it used to be called the little brain, is just as critically important for thinking and memory skills as any one of those regions in color. The cerebellum also has a ton of connections running from the cerebellum to different parts of the brain. And so it's absolutely critical in terms of our thinking and memory skills. So I want to talk a little bit about, I've used this word cognition a lot, and I want to talk about what the different cognitive domains are and what they cover. So I'm not going to go through each of these for the sake of time. I'm not going to go through each of these cognitive domains, but typically when we think of cognition, these are the different domains that we're thinking of. And I want to give you an example of how a formalized assessment of cognition might unpack some of the things that you see in your daily life. So one of the things that I see in my practice as a neuropsychologist is people coming in and saying, I'm not remembering things, I'm having memory difficulties. It's pretty common. But what's causing those memory difficulties and how are those coming to pass? So let's take an example of, you have a doctor's appointment at 4 p.m. on Thursday. Someone tells you this, that you have to remember for a later date. You have a doctor's appointment at 4 p.m. on Thursday this week. And, well, I shouldn't say this week, perhaps next week. And, one of the things, the first thing is, did you hear the information, right? Were you able to hear the information? Did it register? The next thing is, were you able to pay attention to the information, pay attention to it, attend to it, so as to be able to then later learn it and encode it? So that learning process, that encoding process is equally important. And in ataxia, that learning and encoding process is often slightly impacted. And again, ataxia is so different, it's so varied amongst the different syndromes, amongst the different causes. So ataxia that's caused by a stroke, it looks very different in terms of cognition to one that's caused by MSA or one of the SCAs. And so I want to highlight that you might see a lot of variability here, and I'm going to come back to that. But that learning piece can often be somewhat inefficient in ataxia-based syndromes. And then there's the piece about, well, did I learn the information? Did I store the information? Did I store it appropriately so that then I can pull it out later? Can I retrieve it later? And then there's the question of, well, can I distinguish between the doctor's appointment at 4 p.m. versus another doctor's appointment at 9 a.m.? And so these are the different pieces that go into sort of learning and memory, right? And there can be a breakdown at any one of these points that I just mentioned. And so it's sometimes, it's often my job to figure out where the breakdown is happening and what that means in terms of the person's daily life. So we do a comprehensive assessment of these cognitive domains. Like I said, there's a lot of variability in different ataxia syndromes. It really depends, the cognitive presentation really depends on what's causing the ataxia. So your genetic ataxias, the cognition pieces there look very different, like I said, from folks who've had a stroke that's causing ataxia, from folks who have, for example, an MSA. And so it's really important to figure out what's the underlying piece, what are the cognitive correlates of that ataxia syndrome. The other thing is there can be comorbid diagnoses. So for someone who has epilepsy as either part of or in addition to the ataxia syndrome, that might impact cognition to a very wide degree or pretty extensively. The cognitive domains that are often impacted in ataxia, and again, there's a lot of variability here, like I said, but executive functioning is a big part of that. And when I say executive functioning, I mean that ability to switch back and forth between things, that ability to multitask, to plan, to reason, abstraction. And I know I'm using a lot of technical words, but it's a little bit of that higher order. Think about what a CEO of a company would do. That CEO of your brain is executive functioning. Sort of the planning, organization piece. And then attention also tends to be impacted. Memory, like I said, it's not as much that forgetting piece, but it's more that learning and then retrieval piece. And the other thing I'll say about this is that there's cerebellar cognitive affective syndrome that some of you I know have heard of. And that can cause very wide-ranging impacts on thinking and memory skills, and it's coupled with this emotional dysregulation that Dr. Carriere is going to cover in a couple minutes. So I want to talk briefly about how to identify when it's time to sort of bring this up to your neurologist, right? Are things changing? Are things changing, or have they been the same as they've been for several years? If you find that there's change, I would bring it up to your neurologist and sort of plan from there. The other thing to pay attention to is severity and frequency of errors. If they're pretty infrequent, they're not big, there's no major consequences of those errors, it might just be someone having a bad day, but if there's errors being made frequently, you're going, this is not typical. I would bring it up to your neurologist. And then, as I said, a formal neuropsychological evaluation where we unpack those cognitive pieces is always a good idea. As far as what might cause cognitive impairment, of course, there's the ataxia syndrome itself, there's neuronal dysfunction or neuronal degeneration. There's also the possibility of, like I said, comorbid conditions, one of which is, well, I shouldn't say one of which, but a lot of which have to do with the mood and affective pieces. So depression, anxiety, et cetera, could also impact one's cognition. There are medication effects, medications that might be very needed, but a side effect might be that they unfortunately impact cognition. And so it's important to consider where are these, what might be affecting cognition and what can we do about it. Like I said, depression, anxiety, those neuropsychiatric aspects can be very impactful. And with that, I'm going to turn it over to Dr. Carriere.
All right. Well, thank you, Dr. P. That was a great kind of segue into talking about the changes that we see when living with ataxia that are affecting our mood, in general, our emotional state. And so I've listed here some of the kind of various different neuropsychiatric, which is just a big fancy word for saying that there are changes in mood and thinking that can occur in the context of neurological disease. And we commonly refer to these as neuropsychiatric symptoms, but as you can see, they're very broad. They can be far-reaching. What you see on the top row are more of the commonly encountered changes in one's emotional state. So that may be depression, anxiety, apathy, as well as sleep disruptions. Less commonly, we may encounter irritability, agitation, disinhibition, so some behavioral changes, some impulsivity, and psychosis or hallucinations, delusions, fixed beliefs. These, again, are much less common. We don't tend to see these as much. They've not been reported as much in the literature, but certainly really where we have seen more emphasis is really understanding those changes in mood. All right, so how do we make sense of these different changes? Well, you go looking into the research literature and the prevalence rates, that is, how common is this, is incredibly variable depending on the type of ataxia. And even when you start to look at the different types of genetic forms of ataxia, it becomes really quite complex as you're trying to kind of better understand, well, if I have SCA3, how does that differ from SCA8, for example? And this is where it can become a lot more nuanced in terms of what we can expect, unfortunately. And there really hasn't been a lot of research really kind of understanding that piece of it, and certainly is an area for growth for us within the field. But again, those symptoms can vary. Are we seeing more behavioral presentations? Are we seeing more depression, changes in behavior? And one thing that can make it really challenging clinically from a provider side, meeting with your doctor, is trying to detect those symptoms, right? So when we think about some of the common symptoms of depression, we're often thinking about a loss of interest in activities. We're thinking about fatigue, sleep disruptions. We're thinking about changes in our attention and concentration. And you may be hearing those right now and thinking, well, that kind of captures what I feel with my ataxia. And so it can become confusing as we try to understand, Well, am I experiencing some changes in mood, things that I really do need to talk to my doctor about? Or is this what I'm expecting and kind of part of my disease course with ataxia? So again, there's a lot of overlap, and of course you can have both. And so again, really brings us to kind of emphasize that awareness in those symptoms. One thing we often think about with depression and anxiety are these kind of two separate entities, right? Are you feeling depressed? Are you feeling worried? But more often than not, it's two sides of the same coin. They generally co-occur together. And that's something that's really important for us to think about with ataxia. If there's two symptoms that are probably the most common, it's depression, right? Feeling, again, a lower mood, feeling sadness, changes in activities, or we're seeing that anxiety, worry, panic even. And unfortunately, the presence of these two symptoms or even disorders can certainly increase your symptom burden with your ataxia. It can make things just that much heavier. I often like to describe it to my patients as it just feels like a big, heavy, wet blanket. It kind of just follows you everywhere. And so the impact that it can have on you and your quality of life, I probably don't need to spend a whole lot of time talking about because it can feel kind of obvious, right? It's hard to kind of get up and get moving and going to your rehab visits or accepting an invite from a friend to go out to lunch or hopping on and joining your support group. When we're living with depression, it can slow us down even more. And we've got enough of that already when we're living with ataxia. We don't need any more added to it. Conversely, the same thing when we think about anxiety. Care partners. Oftentimes, those caring for loved ones with neurodegenerative diseases will more often than not identify the emotional symptoms of these diseases as most challenging for them. It's less about the motor symptoms, it's less about the changes in cognition, but it's how do I help my loved one when they're depressed, when they're apathetic and pulling back from life, or they're so anxious and so worried of anticipation of what's coming next, it paralyzes them. So it just brings to the forefront the impact that these symptoms can have on you, the one living with ataxia, but also those in your life. So how do we start attending to these mood and anxiety symptoms? Well, I like to think about it really on a continuum. We know anxiety, depression, sadness, it can be part of just life in general, right? None of us are devoid of stressors in our life. But if we're starting to kind of look at it, right? How often is this occurring? Am I noticing it more days than not? Is it kind of taking over the day? Is it affecting these activities? Am I pulling back from life? That's where I start really kind of honing in as a clinical psychologist and really wanting to understand how much is this affecting you? What are we noticing from those around you? So oftentimes patients may say, this is just kind of life. I've been living with this for so long now, I really don't even think about it. And I'll have a care partner in the visit with me shaking their head saying, yes, that is what's going on and I'm worried and I'm concerned about this. So it really brings it to the forefront. Let's talk about it. Let's better understand diagnostically where are we at? Are we going through a little bit of a rough spurt? Or are we seeing enough intensity and frequency that we're now meeting criteria for a clinical disorder? Meaning we really now need to think about treatment, because the consequences of not treating this are far-reaching. And these are things that we want to emphasize that we don't want you to live with. We have good treatments for these, right? But it's all about personalization. So as Dr. Pedungi was mentioning, the reasons behind mood changes, anxiety symptoms in ataxia are pretty complex. Certainly there's the neuroanatomy changes that are happening in the brain, but there's also that elephant in the room of adjusting to life with a disease that doesn't have a cure, where where management is really focused on symptom management, and you're adjusting to life every single day in learning how to navigate this disease. Really what I like to say, it's kind of building that psychological muscle each and every day when you're living with ataxia. And there's also that piece that could be contributing to how you're feeling about yourself and your mood in general. Recent research has really kind of started to look at this, and what we have found is that, for those who have pretty significant motor disability, we actually don't see a similar presentation in terms of severe mood and anxiety symptoms as we might expect. Conventional wisdom might tell us, well, the more disabled I am, the worse off I'm going to be from an emotional perspective. That's actually not what we see. And so again, it really speaks to the importance of understanding you and your individual journey with this disease. And here we come to, I think, kind of my favorite aspect of this, and it's understanding the psychological journey in living with ataxia. It's really beyond kind of how you meet certain clinical criteria for anxiety and depression disorders. Those are important and we want to catch those. But I think the bigger picture here is, again, how are you living life? There's lots of ups and downs. There's a fair amount of unpredictability and uncertainty with what's the next day going to hold, let alone a year from now. How am I planning out my future, thinking about my job, my career, family, children? What do I want my life to look like? As this progresses, where's my say in what I want my care to look like? Who's going to be in my village? That's important things that we have to think about. The ongoing adjustments that you're feeling in your body. At times it may feel like your body isn't even your own. What's happening, right? And a lot of the neurodegenerative diseases that Dr. Padamji and I work with, there's a lot of invisible symptoms, meaning a lot of those changes that are happening cognitively. But then there's a lot when we think about with ataxia that are visible for the world to see. You can actively see that I have difficulty at times with my coordination and walking. And there's an added psychological element to that as I'm worrying about, well, how are you looking at me and what are you thinking about me? How are you viewing me? And that is powerful, especially as we may start to kind of question our own confidence in our body and how we conduct ourselves and how we project our speech. Oftentimes, what's going to happen? We pull back, right? It's safer. Our brain is saying it's safer. Pull back. But what do we miss out on? Opportunities to engage, opportunities to live a life. And may that life, will that life look a little bit different? It may. It may in order to kind of stay engaged. It's also navigating a lot of those difficult emotions, right? The fear of what's coming. Maybe there's shame in thinking about this and thinking about this as a parent and thinking about, again, your experience. And I can't conclude this talk about the psychological journey without acknowledging that there's also joys and triumphs in living with ataxia, and thinking about what you can do, right? And thinking about the abilities you have and that you're continuing to cultivate by going to rehab, by engaging in a social network, by just trying to live your best life, and how important that really is in thinking about this. So many of you are here and have been here in recent years to these different conferences, and you're here, and hopefully it's also to celebrate what you've done over the last year and to really kind of give kudos to that too. All right, so when we think about, again, how do we treat these things? How do we approach when we have mood changes that are present? Unfortunately, the evidence is really quite lacking. There's really not much that has been published in terms of psychological, kind of non-pharmacological, non-medication approaches to managing ataxia. Certainly there's self-help approaches, which you'll hear a lot about, and maybe even your doctors are talking about when you're going to visit them. Hey, are you exercising? Are you getting some sunlight? Are you engaging in hobbies and just social activities that bring you joy? Are you, practicing some relaxation and mindfulness? And those are all fantastic, and those can sometimes help stave off when we experience tough times in our life. But we also want to think about, though, the role that professional help, specifically professional mental health, can provide in terms of talk therapy. Sometimes, and I'm probably a little biased as a clinical psychologist, but there's just nothing more powerful sometimes than sitting with another person and holding space with them in a non-judgmental way to say, let's talk about what's going on. Tell me about what's going through your head. Let's unpack all those anxious thoughts. Let's unpack some of those worries, what's on your mind, and devise a plan, and hopefully walk out with tools and skills to tackle those and to better manage that. We've also seen a little bit of evidence in the neurodegenerative space and the power of mindfulness, as well as music therapy. And I know we've had a little bit here during the conference, so hopefully you've been able to kind of take part in that. We know that, again, within psychotherapy as a kind of treatment modality, there isn't a lot of research published specifically in looking at those with ataxia who have participated in it, but we can pull from the neurodegenerative space in general, other progressive neurological disorders, and their experiences in psychotherapy. I think that can help us from a kind of perspective of living with ataxia. So what have we learned from those living with those progressive diseases in their experience with psychotherapy? Well, we know that the adaptation piece is important. It really should be really adapted to understanding you, and that's important. It's finding a therapist that you feel can understand you. Will they be an expert in ataxia? It's highly unlikely, but it's really about sharing your experience. I can sit with dozens of patients with ataxia, and each one of them are going to have a different space. But I certainly bring that in my approach. How have you been feeling this week? So when you feel that anxiety, what's it translating like in your body? That's where I'm starting to adapt it. We also need it to be accessible and flexible to you. So thinking about virtual platforms, for example. Therapies that focus on acceptance have also been regarded as pretty beneficial. So again, where are you at in that continuum in your acceptance of ataxia? What is that like for you? But again, the benefits really speak for themselves in terms of improvements in mood, quality of life, and the biggest piece is just a sense of confidence in your ability to manage this. So when we think about, again, big picture, how are we advocating for ourselves in this space of mood and cognitive changes? Well, it's really learning, again, more and more about yourself. And boy, if there's anything I've learned from the last day and a half here, it's how much you all know about your different forms of ataxia, and that's powerful. But bringing those conversations forward with your doctor is critical. Talking about what you're noticing with your mood, with your thinking changes. Again, you see something, say something, talk about it, bring it up. It's so important. Care partners, you have an enormous role in this as well, to really kind of either encourage, empower your loved one to talk about it at their next visit, or to bring it up yourself, assuming that you're able to attend with your loved one. Again, it's really about building your sense of community. Each and every one of us as providers has a role in helping to manage your mood and cognitive changes. Whether it's your rehab provider, these other medical specialties, bring it up. Of course, with mental health, we talk about it a lot, as well as hopefully with your neurologist, but it's so, so important. Again, the power of social connection is huge in terms of building your sense of resiliency in the face of these challenges that ataxia is kind of throwing your way. So just in summary, hopefully you're able to walk away from our talk today and just recognizing the importance that mood and thinking changes can have on your life. The impact of not treating those is significant, and we're here to tell you, we may not kind of know, and maybe some of your doctors may not always know too, the right way to go about it. But what we want is somebody that's engaged, that understands you, and you feel the confidence that they hear me, and we can try and figure out a personalized approach together. All right, and with that, we will take questions today at the Q&A due to time. Thank you.
right. I think that it's time for a break. What do you think? Yeah. So it's about 9:45. We'll see you back here at 10:15, and then we'll resume. Have a nice break, everyone.